Welcome to the second part of the video. Let's review the main points from the first video. Iron is an essential trace element that is involved in many vital body functions. Iron is a major component of hemoglobin, a type of protein in red blood cells that carries oxygen from your lungs to all parts of the body. Iron is essential for a lot of processes that are important in the life of everybody. For example, iron helps to maintain a normal cognitive function, upholds the normal process of cell division, supports the normal function of the immune system, and reduces tiredness and fatigue. Let's take a look on how iron is absorbed in our bodies. One way is by absorbing the heme iron. The heme iron is an iron protein complex that we consume via animal products like meat or seafood. It is absorbed into the cell via a special heme carrier. This turns out to be very effective. Thus, humans can absorb about 20% of the heme iron ingested with food. Another way our bodies can absorb iron is in the form of iron ions. Iron ions can be released into the digestive tract as trivalent iron or bivalent iron. For active transport into the cell interior, trivalent iron must first be reduced into bivalent iron. Since our Biolectra iron direct sticks contain bivalent iron, this step is not required after the consumption, and the iron ions can be absorbed directly. The European Food Safety Authority (EFSA) named the following values as population reference intakes regarding iron for different ages, genders, or life circumstances. These values can be used to determine how much iron we need to take in every day to cover the body's iron demand. To determine whether a diagnosed anemia is caused by iron deficiency, ferritin and transferrin levels can be measured. Ferritin is a protein that stores around 25% of the iron in the body and releases it when needed. On average, adult males have about 1,000 milligrams of stored iron, enough for about 3 years, and adult women have about 300 milligrams, enough for about 6 months. When iron intake is chronically low, these stores can become depleted, resulting in lower than normal ferritin levels and decreased hemoglobin. Iron deficiency occurs in stages. The mild form begins with a decrease in stored iron, usually either from a low iron diet or from excessive bleeding. If this does not resolve, the next stage is a greater depletion of iron stores and a drop in red blood cells. Eventually, this leads to iron deficiency anemia (IDA), where iron stores are used up, and there is significant loss of total red blood cells. Typically, a doctor screens for anemia by first checking a complete blood count, including hemoglobin, hematocrit, and other factors that measure red blood cell volume and size. If this is below normal, ferritin and transferrin levels may be measured to determine if the type of anemia is IDA, since there are other forms of anemia not caused specifically by an iron deficiency. How does anemia look like in our bodies? The red blood cells are smaller and irregular in shape. They carry less oxygen and appear paler under the microscope. The person's body cells don't receive enough oxygen. Therefore, anemia may be accompanied by the symptoms mentioned before: reduced physical performance, fatigue, lack of concentration, and an increased susceptibility to infections. Especially at high dosages, some iron supplements may cause gastrointestinal side effects. With 12 milligrams of iron per direct stick, Biolectra Iron Direct offers a gentle way of supporting the daily iron intake because of the coating technology with the special coating of the granules. This leads to a slightly retarded release of the iron, exposing the gastric mucosa only gradually to the trace element. An in-depth laboratory analysis of our product shows the successive release of the contained iron in an acidic milieu similar to that of gastric acid as shown in the graph. All in all, Biolectra Iron Direct is the ideal solution for people who cannot cover their iron requirements through diet.